Hi, my name is Jessica Sossaman. This is my individual presentation, and I decided to present on VRI interpreters specifically in the healthcare industry. For a little bit of background information, video remote interpretation, also known as VRI, is an innovative solution that provides immediate access to a medically qualified interpreter while allowing visual communication that more closely resembles face-to-face encounters. Services are typically ready on mobile devices instantly and are charged at a per minute contracted rate. So this does allow the organization to only pay for the needed usage of interpretation. And a little bit of reason as to why interpretation is so important in healthcare. According to the Supreme Court case Lau versus Nichols of 1974, healthcare organizations that receive any sort of reimbursement from federal health programs, such as our Medicaid and Medicare, have a legal obligation to provide language access to the LEP, deaf, and hard of hearing patients. And so with hundreds of languages being spoken in the United States, it is essential to have a cost-effective and timely reason and ability for these services. So we do have over 25 million residents in the United States currently requiring a spoken language interpretation, and approximately 4 million of these are deaf or hard of hearing patients requiring ASL. And so we must successfully manage the risk and be compliant with the law. So healthcare providers must develop a comprehensive program to provide language access to their patients. Having staffed interpreters through the organization is nearly impossible, as it would require the need for too many FTEs. And even providing staffing for the most common languages is not equitable once salaries and benefits are compensated. So another translation method is over-the-phone interpretation, or OPI, and this is significantly more cost-effective, as an estimated 60 to 90% of communication happens non-verbally. So that means OPI might not be the best effective and efficient option for communication, as in the healthcare industry, non-verbal communication is such an important resource for clinicians. And when looking at contracted face-to-face visits, there are a lot of difficulties and deficiencies that do happen. So it can be difficult to schedule these interpreters. So if they do no-show the interpreter or the individual, there are a lot of risks and possible financial consequences with that. In addition, third-party on-site interpreters do typically charge a 2-hour minimum, even if the patient encounter is only a mere 15 minutes. So as we can see, there is a definite need for some sort of innovative option when it comes to interpreters, as it is such an important aspect in the healthcare industry. Therefore, we've seen that benefits of VRI interpretation are immense. Even looking how the no pre-scheduling is required, it operates on mobile devices and computers with access to a webcam, and there are a lot of long-term goals associated with this innovation, such as the continuation of providing vast interpretation options, meeting the legal obligations, and maintaining a high level of patient satisfaction, which in turn is the #1 priority of a healthcare organization. The technology requirements of VRI interpretation are fairly simple, so an implementation into an organization would be rather seamless, as there isn't much infrastructure-wise to implement into the organization. This is such a current important technology issue because as the world becomes more globalized, it's important that we are able to make sure that our healthcare organizations are able to accommodate these growing populations of individuals who do speak other languages. In addition, telehealth is becoming a more and more mainstream way to access healthcare. Therefore, these organizations need to be able to connect these individuals with an interpreter securely and efficiently while staying cost effective. In today's market, we do have a vast amount of vendors who are available to provide HIPAA compliant, medically focused VRI interpretation services in a variety of ways through a variety of different technology features. There are a good amount of these organizations that will provide the services on already existing equipment, such as laptops and mobile devices, as long as they do have access to a camera of some sort. And so this is really important when looking at the implementation of being able to use already existing equipment. So in healthcare, we want to ensure that an implementation is as simple as possible to ensure that we do keep those adoption rates up. Therefore, using already existing equipment helps curve the learning edge of those clinicians, allowing them to better adopt these products because there is less of something to learn from it. From a technology and IT standpoint, this also is something that is important for implementation. That way you don't have to manage even more devices in your organization and have the staffing for a complex software. And through VRI, real-time analytics and reporting can be gathered, which again is incredibly important as we talk a lot about big data in healthcare. And so we are able to get those insights and utilization patterns and be able to leverage those to best practices, especially with some of those more vulnerable populations, such as the deaf, hard of hearing, or limited proficiency. And overall, when we look at the greatest challenge, it's really ensuring that adequate education for clinicians to use the product, as well as selecting a vendor that really does best meet the needs of that particular organization. It is well known that technology is slow to implement in healthcare, even something that is so basic as a video chat. We've seen with telehealth how slow it has kind of taken up until this current COVID-19 pandemic, where it really forced individuals to gain traction and really utilize the services. And some of that trouble does come from the payer perspective, but when it comes to interpreting, that isn't reimbursed by health insurance companies or the government, so it is the sole responsibility financially of the healthcare organization. So it's really important that we do leverage these newer technologies, such as the video conferencing, as well as utilizing these vendors who do provide it at a low cost, instead of using some more cumbersome methods such as over the phone or even in-person interpretation. So thank you so much for watching my presentation.